I think it's made me much more aware of like the size and scope of the digital health ecosystem. I think when you're in a hospital, you're only really exposed to the tools that you're using, and I think understanding this world and like the more people you meet, the more conversations you have, I think it's like quite humbling, and you kind of learn, like it's just made me infinitely more curious about one, what's possible, but also like what makes a great product or what makes a great service, and I guess in a hospital you take for granted how much effort it takes to get a tool or a product in your hands as a clinician. And so yeah, I think much more curious and much more open-minded in terms of like creative solutions for problems and things like that.
Do you think it's made you more creative?
Absolutely. I think it's helped me like rediscover my creativity, if that makes sense. So it's
okay.
lateral thinking and kind of being challenged to think about problems in different ways,
right.
and kind of drop the dogma that can sometimes be associated with clinical work. But yeah, it's been
right,
really
because
fun.
I imagine in your previous role you're like operating within certain parameters, and now you're totally the box is gone, you're outside the box.
It's very
right?
much an algorithm. You just, it's pattern recognition, and then you enter an algorithm, and then you kind of just follow that through and
in your
clinical work. And
okay.
whereas like, now I'm having conversations with non-clinical people, and they're asking me why we have a problem, or have we considered this solution or like that solution. And I think when you have a lot of people with lots of different perspectives on a problem, you can very quickly start challenging what you thought was gospel or what you thought was like the obvious fix. I think you kind of realize that there are many ways to skin a cat, and I think there are plenty of different ways that you can creatively solve problems, which is really exciting.
I can see, you said the word humble. I can see how that would be humbling.
Absolutely.
In that you're letting go of previous
I think it's like
dogma.
in the hospital, you are the master of your environment, and as you get more and more senior in your career, like increasingly it's you're leading teams, but recognizing that that clinical experience is important, but it's not necessarily the only thing that matters.
Right.
It's really important, and I think you've got to be open to hearing and being challenged, because that's ultimately where the good stuff happens, and
the growth,
the growth personally, but also like from a product side, and that's where you get a great product. Going good to great is about being aware of you might be wrong, and test and like also experimenting and being okay, like testing hypotheses, and just don't get stuck in that perfectionist loop. Just like settle for progress and keep moving in the right direction. I think is really important.